Welcome to the NHPPA Talk Forum. My name's Sean Buckley. I'm with the Natural Health Product Protection Association, and I'm very pleased to have with me Dr. Sean Caesar, ND, and Natasha Lissos, R decimal TCMP, and we'll go into what all of that means in a moment. I'm going to have my two guests introduce themselves. It's interesting, though, you don't know when you watch these, we kind of have a pre-discussion and, oh, well, what are we going to cover and all of that. And we're just talking about, because both Dr. Sean Caesar and Dr. Natasha Lissos. Oh, I'm not supposed to say doctor, sorry.
Right.
I don't want to get anyone into trouble. Well, that's not true. But we were just discussing the health show. So the world's greatest health show that the NHPPA is putting on, because both of you will be sharing your stories and what it's like to practice, and some of the most important people you've dealt with, and then the most important because they came to mind. When you're trying to figure out who do I talk about. And I was sharing with you, and I feel I want to share it with the audience here, that I've been affected. I've been doing these interviews, and I'm getting affected personally with the stories. So, and what's surprising me is I knew going into this that just as you do, and I'm going to invite everyone to, seek out what you share at the health show, because it's going to be people will find it compelling. But I knew going into this that this is our access to natural health products and our access to, natural health practitioners like yourselves. It's a matter of life and death. Like I know this. That's why I got involved with this, because, 1994, 1995, I learned that this is life and death. And I've had file after file where I understood this was life and death. And I can't tell you how many people share their stories. Through the years, if I was lecturer, there's always people that come up to me after and share their stories with me and just try to encourage me, because they understand it's life and death. And yet interviewing these people for the show, I'm finding I'm distressed. Like, I'm distressed. I'm having moral distress because I'm hearing, and they're success stories, right? Like, they're success stories, and I'm still finding this difficult, because why are we having to go through this exercise? Can I just share with you, an interview I had this morning, and it's not a life and death story, but it just kind of slapped me, and I'll tell you why it slapped me. So I'm interviewing this lady, and at the time of the story, she's a young mom with 2 young kids, and that's exhausting by itself. But she gets restless leg syndrome, and it's not a problem during the day, but at night when she goes to lay down, like she feels like she's being shocked in both legs. It's painful, it's uncomfortable. So the only way to stop it is by walking around. But it means she's walking around all night through the night, and she's getting fatigued and grumpy, and she knows her immune system's run down. She's catching every cold and flu that comes along. And the medical doctor is only offering a drug that they use for Parkinson's disease. Has no answer at all. And, she looks into the side effects of those. And one of the major side effects is actually, twitching, tingling muscles. And it's like, she wasn't willing to do that. And then, somebody says, well, go see a naturopathic doctor. And like, just right off the bat, naturopathic doctor puts her on a type of, magnesium diglycosate or whatever form of magnesium it is. And you're like, problem solved. And so she studies holistic nutrition, does a bachelor in science in Florida in holistic nutrition. And basically it's kind of like, well, and then works in health food stores. And then like, it's kind of like, well, of course, for muscle twitches, you would start with this form of magnesium. And what upset me was not that this, like, because this was a success story, but what upset me is if, a patient went to either of you with that problem, you would solve it quickly and likely with magnesium. Like, it's kind of like go to any health food store. That's what, like, it's kind of like everyone knows. How come the medical doctor didn't know?
Mm-hmm.
That's such a big question. So on the medical side, we can talk about, number one is a diagnosis, and number two is a drug, and this is how it's defined, how it has to be acted upon by the medical colleges, right? So if a patient fits into any grade category, and Natasha and I, as alternative practitioners, we look at the whole person and to say, okay, what's the cause of this? What's the root? How do we get to the bottom of this? And sometimes restless leg syndrome can be a mineral deficiency, whether it's magnesium and you give a right form, or whether it's calcium, or whatever it might be. But we're not obligated to come up with the diagnosis and a primary drug that comes after that. So it might be a number of different causes that cause that, but the medical system is a little bit tied down because they have to follow what the college tells them, and that is usually diagnosis followed by, most of the time, first line therapy is a pharmaceutical.
Can I just stop you there? And I see, Natasha, you're nodding your head. So, okay, so what you're communicating is so the medical doctors are basically obligated to come up with a diagnosis, and did. Like, it wasn't just restless leg. There was also a second name for it. I just forget from the interview what that was, but definitely restless leg syndrome, and then offer a treatment. But would the medical doctor get in trouble for saying you're magnesium deficient? Likely. And I get there could be other minerals too, but I mean, can't the medical doesn't the medical doctor know this is most likely a nutritional deficiency? Let's solve it. That would be a treatment, wouldn't it?
Mm-hmm.
Well, yeah, the problem is that with the medical test that would be done, sometimes treatments are justified medically, and I'm talking on the medical side, but I'm not a medical doctor. I'm a naturopathic doctor, so I'm trying to think about what they would have to go through. So I'll just give you an example of what a medical doctor that I know, who's since retired just because he's been in such crisis. He had a patient in that had ulcerative colitis. He said, okay, well, maybe you're deficient in zinc, did the test, and he got a letter from the College of Physicians and Surgeons saying, this is not part of the protocol. You can't use the province's money to pay for a zinc test for this fellow, even though he was thinking, how can I get this guy better? And how can I find out what might be going on? So for ulcerative colitis, that's not in the ABCs of the protocols. The diagnosis, it comes with X, Y, and Z as their treatments, and that is it. If you're outside of that box, you get a disciplinary letter. And for us as naturopathic doctors, I can only speak specifically for myself, is our naturopathic board runs what we can and what we can't do, and our training does too. So our training says, get to the root cause, figure it out, and then let's give natural medicines as a possible solution to these things. So I would be frustrated like crazy, and I would retire like this medical doctor probably has. And to say that, well, wow, if I can't do this test and I'm in trouble for doing this test, then I'm not really helping people.
Yeah, I do feel for them as well, because I think their hands are tied in many cases. So yeah, they might have potentially thought it was a magnesium or any sort of mineral deficiency. But yeah, and with us as well, I mean, we cannot really make a diagnosis. We can make a Chinese medicine diagnosis, right? Sean, you can probably make a sort of a proper diagnosis. Ours is Chinese medicine first, and that we're able to diagnose. So ours would be, we wouldn't say mineral deficiency. We might say a body fluid deficiency and a blood deficiency. That would be our diagnosis.
Right. I mean, is it even remotely possible that if somebody came to either of you with restless leg syndrome, that you wouldn't be able to solve the problem?
Well, there are so many pieces to it. So the idea of mineral deficiency comes up pretty quickly. The other is there a musculoskeletal issue with this, right? And this is where we come in as well. So Natasha, I mean, a big thing for her, and I can only speak really quickly because we are trained in Chinese medicine as well, is the idea, is there a channel that might be contributing to this? And it's interesting, if you back up the medicine to the ancient times, and we're talking Chinese medicine and Ayurveda, which are thousands of years old, 3,000, 4,000, 5,000 years old. Back in those days, they only had an element system, that an element was out or an organ was out, and you had to treat those. Now, with our modern science, we incorporate the Chinese medicine with the modern day. But for me, it might be an examination to say, what are the tendons, ligaments, muscles involved here? And if we need to use something like prolotherapy, which I use, and PRP therapy, perhaps that works for them to get their legs settled down. And where are the trigger points that are causing this kind of thing? So that would be my approach if it wasn't, and we're kind of focusing on restless legs because of this particular case, but there's so many thousands and thousands of different things that can be treated using traditional Chinese medicine or using naturopathic medicine, because we see everybody.
And I was going to say, sorry to interrupt, but you said she's a mom with 2 young kids. So again, for us, looking at the whole picture right away, you've given birth, potentially you've had 2 pregnancies. So what is that going to do to, your minerals, to your blood? Just from you saying a mom with 2 kids, you start thinking a different way.
Yeah. Oh yeah, like this postpartum depression is probably often just a nutritional deficiency that's leading to a mood disorder.
It can be.
I'm just guessing. I practice as a lawyer, and that's what I say. I guess I'm putting the cart before the horse, because I want people to know who the 2 of you are, and also, how much training is involved. So maybe Natasha, will start with you, because I think both of you have gotten more training than the average medical doctor would get, and the training that both of you have gotten is kind of like the norm. So Natasha, do you want to start with maybe how? Well, let's just start with who you are, like what you practice as, what your qualifications are, and how much training it takes to get to be able to do what you do.
Sure. I practice traditional Chinese medicine, as we've discussed. And so it starts with about 4 years of an undergrad or college program. And then you go into a 4-year traditional Chinese medicine diploma. And that's really to learn how to practice acupuncture, after which you could go back to school. Some will just be acupuncturists, and others would like to learn the herbal component. And that's potentially another 1.5 to 2 years. And those are followed as well by board exams in order to make you a regulated practitioner. So that was 6 years. And then 4 years prior to that was the undergrad in kinesiology. So that's 10 years. And I was lucky to use the kinesiology degree towards it as well, because we talked about potentially biomechanical issues maybe causing restless legs. So I find that in just using your example, I found that came in helpful with regard to the orthopedic nature as well of many problems we treat as well.
Right, and then you actually even took further training because you wanted to specialize further. Can you tell us about that?
Yes, and in our phone call, I had mentioned orthopedics was an interest. So I took another 2-year doctoral program through a college in San Francisco. And so it specialized in the classical Chinese medical formulas. And we didn't really explain, but those go back to the original formulas, as well as a specialty in orthopedics. And then I also work with many fertility cases as well. So we didn't discuss that before, but.
Right. So it's really 12 years of training that you've done.
That's right.
Okay. And Sean, tell us about your training, because again, like, it's a lot of training, and why this is important. So like, we'll just go back to Natasha. Is a lot of people have no idea what the practice of traditional Chinese medicine is. They have no idea what the practice of naturopathic medicine is. You know, I'm older than I come across. I don't think I heard of, you know, a naturopathic doctor or a traditional Chinese practitioner until I was in my 30s. Like, it's just now kind of really coming into its own. So I want people to understand that these disciplines, I mean, it requires tremendous discipline and training to be able to do what you do.
Yeah, and thanks for that acknowledgement. That just isn't really that well known. In my experience, folks in BC, for instance, it's everybody has a naturopathic doctor on board, or traditional Chinese practitioner on board. It's a very, very common thing. I would say maybe 70%. And that's sort of due to the local feeling, and that it's totally acceptable, and this is something that you should do. And people tell people, and soon you've got a whole bunch of referrals in your office. And so as a naturopathic doctor, we're trained for 7 years altogether. So Bachelor of Science degree first. And then we have 4 years of full-time naturopathic training, which is similar to a Harvard or Yale medical program in its length and its intensity. So we go over all the sciences, we go over all the specialties. And then after the training is done, we have our licensing exams that as soon as we graduate, and also those go into each of the specialties. And then finally, if you're in a province like BC, where you have your drug license, you go through an exhaustive course to have your drug license. There was 3 pharmacists in my class, and all 3 of them failed. So it's that intensive that they hammer it to you to make sure you know what you're doing when you have your drug license, and that's in BC as well. So I'm not quite as good as Natasha at hanging out in school. It drives me crazy, but it's to get to your degree, and in Manitoba, Ontario, and also in BC, Alberta, in Saskatchewan, it's all licensed. So you can't call yourself a naturopathic doctor unless you have a license in the province. Nova Scotia is like that too. So, and in the States, there's various states that have naturopathic licensure, and you have to graduate from an accredited college, and there's a handful of accredited colleges in North America that have these programs.
Yeah, so that's just a crazy amount of training. So what's Natasha, why did you become a traditional Chinese practitioner? Because that's a pretty big commitment.
Yes, well, and again, as Sean's mentioning about the medicine, you can pick and choose, but I feel with Chinese medicine, like, you uncover one layer, one spectrum, and it's just so vast, and we're still learning about it. So that is why it just keeps bringing you back to study more. But what had originally brought me there was an injury that I couldn't resolve through the, physiotherapy, traditional, like, Western medicine routes. It was like a few tears on an Achilles tendon, plus the muscle leading to the tendon, the gastroc. And so I had tried the cortisone. I had tried many bouts of physio, as I'd said, and went to China, and it got resolved with like 5 days of just acupuncture, Chinese medicine. And that kind of alerted me to there's a lot more to learn. It kind of sparked a passion.
Mm-hmm. a personal experience. Sean, how did you end up, deciding to commit to become a naturopathic doctor?
Let me see if I can phrase this in kind of a short. It was a long journey. The first was kind of soul searching when I left home. I was 18, 19, and I just went down to Mexico just to travel around. And I wanted to find a home, and I didn't find a home in Mexico. I thought, well, I could live on the beach here and just make a few bucks there and here and there. But it ended up being that I came back to Canada, and I ended up in Vancouver. And Vancouver, it was like a reverse culture shock. It was really weird because Mexico is so alive. Everybody talks to each other. It's all thriving, and everybody is just into this sort of discussion. And when I got back to Vancouver, I landed in the airport and I thought, this is really weird. No one's talking to each other here. And this was way, way, way back. And so, but I got into Vancouver because I knew I needed to change location. And I started playing water polo, and I was always fit. I had done international water polo. I had trained, and I was into sports as a kid, and so I thought I'm going to keep fit. So I went to the gym, worked out every day, and then I got a men's workout magazine. And the men's workout magazine had in it this thing called yoga. And this is way back before this. There's yoga centers everywhere now, but this is way back before that. And I thought, what is this? This looks interesting. Let's try it out. So I tried it out that night, and I thought, wow, this is really, really amazing. So I practiced that every day, and I thought, I'm driving a truck here in Vancouver. I really don't want to keep doing this for the rest of my life. So I thought, let's make a profession out of it. So what I knew about, and the funny thing is, it was physiotherapy was what I thought about Natasha, believe it or not. And massage therapy, that was only that came into my conscious. So I said, okay, let's go back to school. Let's study to get into physio, because I picked that one. Because it was stretching, it was doing all these kinds of things. It was yoga enough like. And I got into also the way of eating, which is an ancient science that's paired up with yoga. It's called Ayurveda. Mm-hmm. And that is very much like the ancient Chinese medicine, very much together. And it was using herbs and the way that you eat according to your body type to fix up your health issues. And this is what they did 5,000 years ago. So I thought, isn't this something? I can eat and I can do yoga. Now I want to do a profession. So physiotherapy, I went to school did 5 courses at University of Winnipeg. And then I did the interview, and after the interview, I didn't get in. Thank goodness. Like, that was the best gift that I was given. I was pretty upset at that time because all I knew was physiotherapy. So I went back to the guidance counselor at University of Winnipeg, and I said, Elfie, I'm going to go into physiotherapy. I need to do some courses. And Elfie looked at me and said, you shouldn't do a physiotherapy. I said, what? She says, she knew me for 2 minutes. She says, you should do naturopathic medicine. I said, what is naturopathic medicine? I've never even heard of this thing. She goes, and I'm 23, 22. And she says, well, you use herbal medicine, you use dietary therapy, you use acupuncture, you use traditional Chinese medicine, you use IV therapies, you do all these natural things to make people better. And I thought, that sounds interesting. So at that time, this dates me like crazy. You couldn't go on the internet and find the colleges, but she says, get a hold of the colleges, mail them, and they'll mail you the books about what they're all about. So I went ahead at that time, I sent off to the colleges, and I got the information. I looked at it and I said, this looks great. I can't afford the American one, but I'll go to the Canadian one. So I applied, got in. And after the first year, I switched over to the National College of Naturopathic Medicine, which was in Portland, Oregon. And my grandfather actually gifted me some money because it was quite a bit of difference between those two. And then that was the shortest version, I think, I've given of how that whole journey went along. But it was not something that I thought of at all as a kid. I did not want to become a doctor or a doctor of naturopathic medicine, anything at all like that. I was going to be a rock and roll star, or that was kind of my dream as a kid, but certainly not this.
Did you go back to the guidance counselor after?
Well, the interesting thing about that is she had a sister in naturopathic medicine. And then her sister, who was in naturopathic medicine, became a good friend of another naturopathic doctor I had met and became friends with. So every Christmas, we'd all four of us, Elfie and her sister and the naturopathic doctor and myself, would go out for tea together to kind of celebrate every Christmas every year. And it's a matter of like lots of things in life. You know, sometimes you meet your partner, it's a 5 minutes, you could be in the same place and that's it. And then bing, everything happens. If it was the next day, I said, okay, forget it. I'm not going to go to this guidance counselor today. I'm going to go tomorrow, right? That would have been a life changer and I wouldn't be here where I am right now. So that's one of those, you know, eclectic magical moments that I thank goodness every day, because really every day I'm at work, I love it. I've been doing it for over 25 years and I've never looked at the clock and said, wow, I can hardly wait till 6 o'clock or whatever. Every moment is a huge joy, just because you're giving the gift of life. You're giving the gift of health and happiness. You're giving a gift that's bigger, I believe, than anything you can give, bigger than money, for sure. I'd rather be able to give patients, you know, the joy of a better life every day and a longer life. And I just think I'm pretty lucky to be able to find, I call it a path with heart is what I call it.
That's beautiful.
Do you feel similar, Natasha? Like what's a kind of like it?
No.
It almost segues into is suggestion. Are you in the right place?
Oh no, absolutely. I love what Sean was saying about coming home. Many times it's the same thing. It's like, am I going to go home? But it feels like home, treating patients daily. You know, it is, and as he said, giving them life, because each case is so unique, and you have the tools. Like you feel like you have the tools. That's why I'm not upset not following the route that I had thought I would go, because I would have been limited, as Sean's saying. Like within our scope of practice, we can try. You know, we have many tools at our disposal to take our patients to literally another quality of life, another standard of health. So I feel very, very honored to be able to practice it.
Just to put some context for people watching. So we'll start with you, Natasha. What percentage of people coming to you for help as a traditional Chinese practitioner have, you know, prior to seeing you? So for the first time, because I appreciate after somebody's seen you for something, they will come back for something else. But for the first time, so when somebody's first coming to you, what percentage of those have tried to find relief in the medical mainstream system first?
I would say about 95%. And then I will push it a level further. Like once they do come to me, I really talk about a circle of care, and it takes a village. So I have a lot of naturopathic doctors that I work with. Also in the physiotherapeutic world, osteopathic support as well. And I feel like you're sort of a meeting place. Your patient does come to you, and then you're able to give them other guidance that potentially, so hopefully they won't be waiting that long, you know. But yeah, many times it's about 95%, and they've exhausted all routes in the Western medical world.
Right. And you see, that's kind of interesting. And I think we can understand, well, I don't know, maybe we can't understand but when I grew up, like the only option was the medical doctor. And I still think that's my first thought. And then it's kind of like, no, I don't want to go, right? So yeah, I can't even remember the last time. But you know, if something acute happens, I may go to the hospital, right? So yeah, so Sean, same question for you is, and so I'm not talking about people that have come to you already and then they're coming back, but when somebody first comes to see you, what percentage have already been through the mainstream medical system?
Yeah, so very similar to Natasha. I mean, I'd say 100% have been through the medical system, because it's for me, it's cancer and pain. Those are two of my focuses, right? So For pain, they've usually tried the traditional route, like Natasha had, which is first of all painkillers. Then there is the option of physiotherapy, and then they say, okay, you know what? If that hasn't worked, then they see a surgeon. That gives them some advice, which is usually they get much more information from coming to see us than they have for certainly in the medical system. That was without a doubt almost 100% of the time, because I'll go through and tell them through a good exam exactly what's going on, or through their lab work, and they say, I've never heard this. This is all very scientific and very legitimate, but it rings with them because they understand, okay, you know what, this shoulder problem, this hip problem, you're set up to do hip surgery. I don't want to do hip surgery and I have to wait 2 years. How can I get out of this? And I said, well, let's first of all do an exam, and I'll find maybe it's the SI joint. They came in, they say it's my hip. It's not their hip. They don't need their hip out. This hip surgery wouldn't do anything. The treatments that I use, PRP, prolotherapy, are to fix up an area that that was misdiagnosed. So very often it's not an area, and people say with their low back, it's always a disc problem. They've got a pinched nerve back there, which is rarely the cause for low back pain. And these are instances where, so people will come in 100%, they've been through the system, they've either chemotherapy has failed them, or their medical system, they want to incorporate the natural treatments with their chemotherapy, their radiation, their surgery, these kinds of things for cancer treatments, which is validated again and again and again, and patients do better. They do better in Germany, which the system is incorporated. So there's lots that have been through the system, and it's really seeing how you can fit in for their best results. Mm-hmm. Can you pair in with what's happening medically? And then the patient decides, well, I never take anybody off painkillers, but virtually at least 75% come off. And I say, how's it going with the Tylenol? How's it going with the Robaxacet? Oh, I stopped that because their pain is resolved. They're off it, and they're off it permanently. They don't have to go back to these things. So the medical system has its pros and cons. The pros are, if you're in an emergency, don't come to my office. You got to get to the Health Sciences Center. You got to have, that's the way to go. As far as the cancer and the pain, in my experience, that's what I treat almost exclusively. There is a lot that can be offered together, and a lot that can be offered solely by the natural practitioners.
I think that might surprise people. What's I guess both of you said, oh, I really like going to work and stuff like that. And, but
and we made, yeah, that's very authentic, right?
Yeah, well, then that was foreign to my experience. So as a lawyer, but then I didn't like conflict, and I never planned on being a lawyer. So I'm a little envious here that you guys are in a career that you like, but it's probably on a day-to-day basis. I mean, you have a lot of responsibility, and I imagine you are kind of seeing patient after patient after patient, and you're dealing with a lot of people in distress. So, like, Natasha, kind of what is the day-to-day like, and how do you handle it when you're, because I imagine you have people showing up and they're in tears and they're suffering, and how do you handle that, and what's that like?
Yes, and even when you're saying, you're hearing people's stories, so that is what our day is about. It's about really listening to patients and hearing them, feeling their distress. So there's many mechanisms to help. Like in my case, you have to have your own practice. So I try to practice Qigong, which will, again, it's called the gathering of energy. So you do some Qigong on yourself. You have to have your own practice in order to be the best that you can be, right, for your patients. I also go for many treatments. I love going for osteopathy, naturopathic, craniosacral. Sometimes I have a business partner sometimes says I should go for psychotherapy. So you have to do everything to be the best that you can be for your patient. So you're right there. And there was a saying in the Psalm tradition of acupuncture, which is based it's a Korean tradition. It's a saying like, your patient is the emperor before you. So that is how it starts. Obviously, if you feel like a patient is out of your scope of practice, or you need to refer them, in order to get extra support, this is what I'm trying to gauge my first visit. If it's solely myself that can take care of them, or so that's why I have my circle of support. And that's the thing, Sean, you have to just do the best that you can do. I think you're a team, both with your patient, with their subconscious, where they are in time and space when they come to you, and where they are in their healing. So yeah, it's quite a bit to gauge, and that takes time, obviously. I mean, you said you've been practicing law for 30 years. So as a new practitioner, it wouldn't be that simple, but over time you start to understand which direction to go.
Yeah, I'm gonna keep on you here, because I'm just wondering how you carry the weight. And I'll just use I'm not a healer, but I practice law where in the health field, people's ability to continue to help other people, their very livelihood would be at stake. When I had a case where, let's say, Health Canada killed people and yet then charges the company, I would feel the weight of the people who died. So if I lost, then basically we'd be validating deaths caused by Health Canada. And, on the criminal end, because I did a lot of criminal work, that's where constitutional rights are in play. I would empathize with my clients, like these, criminals. I'm sorry, we're dealing with people in crisis. And we're often dealing with people that are in generational crisis, and, families that are on the line, then dealing with the system that, mercy is a new word, and it definitely doesn't apply in our criminal law system. Mm-hmm. And you're against a machine. And I would take that on and, find it, a lot of cases took a piece of me with them, right? Like you basically suffer at a spiritual level. Do you ever experience that, Natasha? Because you'll be dealing with some people that, you're really rooting for, but they're terminal, and like we're finite here.
Yeah.
We don't get to stay around for long, and sometimes you can't stop that. It doesn't matter what the healing tradition is. So do you ever experience some of those tough emotions?
Absolutely. Yeah. On a daily basis. I mean, you are going on that journey with your patient, and I think, Sean, you mentioned something about love. I can't remember, something with the heart.
Yeah, path of the heart. Yeah.
Yeah, path of the heart. And that's the thing. I mean, I think that's what brings us all together. We ourselves are going to be a patient one day. We're going to find ourselves. So you do live a little bit through each of your patients. That's the empathy plus the sympathetic realm. And yes, I think what you're saying is, when it does start to get to you, that's often when I do believe I have to pull back, and I have to get more treatments or take some time off in order to better support everyone. But yes, I don't think you would, I don't think there's any practitioner out there who could potentially be blind to what their patients are going through and not take it back.
Yeah, and Sean, I'll turn to you in a second, but just sticking with you for a second, Natasha. So, somebody comes to you and they're suffering. I mean, you end up empathizing and, kind of in a way participating in that, and then you're walking with them in the healing journey. Like, correct me if I'm wrong, but you become emotionally invested.
Absolutely. Yeah.
And so there's, you're not just being analytical and saying, do this, do that. That's only a part of what's going on. Another part is literally, on an emotional, spiritual level, you're participating in the experience they're having. Am I right about that? Because that's definitely the practice of law.
You are. I mean, let me give you an example. Let's say a patient comes in and they're, laden with grief, like they've lost a spouse and they cannot stop crying. So obviously, I mean, your first instinct as well is you would like to cry with them because you understand, but at the same token, if you were just crying the whole session, then you are losing your energy in order to be there to support them. So it's that fine line of understanding, okay, how far do I go? Obviously, you are there with the pain, right? But you also have to be there to hold the space for them. So it's just learning to differentiate.
Mm-hmm. Sean, turning to you, kind of the same discussion is and especially because of the areas you've chosen to focus on.
Mm-hmm.
And, for both, the people watching, like you have to watch, the interview with Natasha, the interview with Sean, at the health show, and some of the experiences they've had. And so Sean, you're dealing with some people that, I mean, they may have been sent home with 3 days to live or 2 weeks to live, and you can help them live for years and years, but it's not going to be long term for many of them. And how do you deal with that? What's that like?
That's, it's interesting because you two are way more sensitive. And I feel a little bad because I mean, I really have to, I can't get in 100% with my heart. As much as I love what I do, I know that I have to give support for them. So first thing this morning, so I get in and it's a patient that's in early. She's a stage 4 cancer patient, just new diagnosis, very early. She's in her 40s. And I get in there to do the IV and I can look at her face. She looks at me and she just weeps. She starts I haven't met her before. This is the first time I've met her. And she starts to really, really cry. So in that time, I have to be really, really strong for her. I have to let her know that she's taken care of. And so I grabbed her arms and I said, you know what? You're going to be okay. We're going to take our best care of you. Don't worry. And I explained the therapies, everything that she's doing, the hyperthermia, the IV vitamin C that she's doing, the mistletoe. I explain everything. I look her in the eyes and I just say at that time, look, you're looked after. You don't have to worry. All you have to do is lay down and you just have to get the treatments done and you'll be okay. And we'll go over it, make sure that you're doing right and you're being monitored. So in that part, I kind of come out with as much support to let them know that I can work with them and I can be strong for them if they need me there. And sometimes I do just kind of sit back and listen if there's stories or whatever it is. So the next patient that I had seen, we did it over the phone, is stage 4, same age as me, colorectal cancer patient who is now in palliative care. That means palliative care means the treatments have gone through, they've all failed, and they're waiting for him to die. He's 57, the same age as me, right? And so he's not on the emotional level of it. He's on more determined saying, there's got to be something that I can do. Why do I just have to? Everybody's saying palliative care, there's no more treatment. Palliative care means that there's no more treatment against the cancer. They're not fighting the cancer anymore. They're just giving him medicines for his pain and his discomfort. So the important thing there is to be, invested. I'm invested to get them as well as they can. And I like that each of us are doing what we're doing, because Sean, I couldn't go to court and do that properly. Like as much as you feel, you're a lawyer that has a real strong heart, and Natasha, you're TCM practitioner that has a real strong heart. And I don't put up a barrier, but I'll lose patience. It's just part of the game with cancer. And I know them and I love those people, and I am invested in getting them better as quick as I can. And it doesn't always happen that way. It happens for a vast majority of people who come in. But so I take a look and say, okay, what could I have done better is kind of how I look at it. How do I learn from what's happened here and turn on sort of my analytical side, if that's a guarding of me getting in but I don't know. I think that each one of us handles, these cases that are life or death in a very unique way. And thank goodness we come up with ones that have kept us at our professions as long as we've been doing.
Yeah. So you do, you kind of reanalyze things to become the best healer that you can going forward.
Perhaps that's my coping mechanism. If I lose people during treatment, or if I don't get them better, their pain isn't quite there, and I say, okay, let's make this a learning. Let's get better. And that's the beautiful thing about doing what we do, is that you can always get better. You can never say I know it all, and that's it. And hang your hat on that, because you're always learning more and more. And every patient teaches you more and more. Everyone that steps in that door, you'll learn more and more. Like today, for that stage 4 cancer patient, there's new genetic testing. So this is what happened to him, if I can go into it a little bit. He had been given a traditional chemotherapy for colorectal cancer. It's called FOLFOX or FOLFIRI. And I looked at all his reports. He had been genetically tested to say that one of the chemotherapies is not going to work for him. This is what the medical system had done. And I said, okay, so you went full FOLFIRI, and that sent you to the hospital for 3 weeks, right? You did one chemotherapy. And he said, yeah, I was floored. I couldn't move. I couldn't do anything. I was in the hospital for 3 weeks after my first chemo. And I said, did they let you know that that chemo wasn't going to work for you? Genetically, they did the test, and it said fluorouracil, which is 5-FU, that chemotherapy is not going to work for you. In fact, it's going to say it probably will injure you. Did they tell you that? And he said, no one mentioned to me about this genetic test. You're the first one to mention that anything was done like that kind of test. And I said, really? So they put you through the test, but didn't follow through with actually treating you properly and not using the #1 chemo for colorectal cancer because it's going to be injurious to you. They did preemptive medicine, and then they didn't follow up, and they gave him the chemo anyways. So that's the perspective he only got from me. He did not get that from his oncology side, who had treated him way back with chemotherapy that not only failed, it almost killed him.
So, Natasha, getting back to you. So,
those are tough cases, Sean.
Yeah, I mean, and they're challenging, and really, it's satisfying, as you know, Natasha, to be able to give not only hope but very real hope. That means they're moving ahead with your experience. You've dealt with so many cases like this, and you've got so many better. And so you're not hanging your salesperson hat. You're hanging your experience hat on and saying, okay, listen, this is what we've worked with, and this is what we can do. And it comes, people know how you're talking to them, and they appreciate that they can connect with those that are looking after their health, because it's a rarity these days to have, especially in the oncology and the cancer side, to have someone who really cares. I really care that patients will do better. I really care. I treat everybody like my sister or my mom or my kids. And people just know that they can feel it, because we're the ones that they complain about the medical system to.
Yeah.
If only I could tape it. And I did lectures, and I'm sorry, I don't want to go on, but I did lectures at the University of Manitoba where they train the medical students, and it was called pharmacognosy. They had this great guy who was teaching the medical students about herbs and the science behind herbs. And he said, can you come on in and talk to the graduating class? And I did this 2 years in a row before he graduated. And I wish that I could have these tapes and edit them of all the things that people say is happening in the medical system, the complaints about how they're treated medically, and just give it to the students just before they graduate and say, don't do this.
That would be excellent.
I think they have I think that's probably now one of the hardest jobs. Like Natasha, you know, you can tell us a story about how your grandfather practiced, and we'll go there in a second, but I get the feeling now that you know, they're really well trained in diagnosis, but it's almost like it's a plug and play. So, and you had alluded to this earlier in the conversation, Sean, that you know, they're supposed to come up with a diagnosis, and then they kind of like plug in a drug or drugs, chemical drug or drugs, to, you know, deal with the symptoms. They know that they're not solving chronic disease. I mean, what like they do surgeries and they do crisis medicine and they excel, and I don't think they excel in diagnostics. I think that's more smoke and mirrors, truly, to be honest with you. Like we have to show deference, but I mean, I remember, and this is probably a good decade ago, but they did a study where they took 3 hospitals in the United States, and just in the order of that people died, they had pathologists do autopsies, and with the question, why did this person die? And, you know, what, if anything, were they suffering from? But they weren't given the medical records. So for, you know, 3 hospitals, we're having all these autopsies done. And I think it was over 50% of the people that died in these 3 hospitals were being aggressively treated for conditions they didn't have.
Wow.
Right? I mean, they're engaging the medical system because something's wrong, and then they're being aggressively treated for conditions they don't have. And when you're given synthetic chemicals and you're given, you know, treatments that you don't need, that in itself is going to rock you, right? So, so that, you know, but they do diagnostics. But I was just talking about, I think, how unhappy it must be to be a medical doctor, and you know, medical doctors are watching this, like, call and we'll talk on NHP Talk Forum, and you can share what, you know, what your experience is like, and you can contradict me or confirm.
Absolutely.
What's that?
I have one for you, Sean. I think you'll enjoy
Yeah,
it.
well, but I think they've lost a lot of their autonomy in the last several years. So, and just like naturopathic doctors in BC have lost their autonomy. I mean, you guys can't go against public health directives that in BC, no medical profession can. They've consolidated you all. And you can't go against public health directives, or your college will go after you. Well, it wasn't that way before. And I think they're getting funneled in. You know, one of the people that we've interviewed for the health show, Dr. Stephen Malthouse, he was a medical doctor for 45 years. He's retired now. And he was finding it really dissatisfying, I think, for about the first 11 years of his practice, because he had gone into medicine, and that's a big commitment. And he'd gone into medicine to help people, and he was really just getting frustrated because he wasn't really feeling that he was helping people. And then, you know, his journey, he comes across homeopathic medicine, and he trains as a homeopathic doctor, and he spent the last 25 years of his practice as both. Like, he managed to navigate his medical college so that they would allow him to practice homeopathic medicine also. And, you know,
yeah. Sorry,
people are, oh yeah, go.
No, I think that is the best way. I mean, Sean was mentioning that in Germany, right? They practice the naturopathic medicine mixed in together with the Western medicine, allopathic. And I know in China as well, they will have within the hospitals, and they'll decide, you know, at least they potentially, if they needed, let's say, an MRI or something a little more aggressive, they could be seen, but then they can also be seen by alternative Chinese medicine practitioners firstly. So I think, you know, what you're mentioning about your doctor, that he became homeopathic, and then he was able to merge the two and decide, you know, how acutely do I have to treat? Do I have to, you know, can I use homeopathic remedies versus, you know?
But the biggest limiting factor is actually his patient's choice, because people going to the medical doctor, like, he can offer both, but they're expecting these scripts. And do you guys think that maybe we're the most restrictive? You know, like, I think in every other continent other than North America, there's kind of more latitude for kind of a blending of traditions.
Yeah, I don't know. I've not practiced out of Canada. I did practice. Actually, that's not true. I practiced in the States. So I practiced in Oregon. We were at a research clinic right after our graduation, and I just find that, like, today, the same patient said, I couldn't get an MRI or a CT scan for my cancer for 3 months. Okay, now this is enough for a patient to die real quickly. I mean, you can die within a month. They said, so I said, okay, forget it. They're offering me a CT scan in 3 months. I'm just going to go down to the States. So they just drove down to Fargo, which is, you know, a couple-hour drive, got everything the same day.
Wow.
And was able to come back. And of course, it showed where the cancer was and what the size was and this kind of thing. So as far as, are we restricted here in Canada? Absolutely. Do we have things that step beyond the reach of what Health Canada should do? Absolutely, 100%. However, the FDA is not too much better down there. You know, the story of Dr. Jonathan Wright, a medical doctor whose office was held up at gunpoint as they went through all their files, because Dr. Wright teaches us as naturopathic doctors. He's a medical doctor, but you can hear you see these stories. I know him quite well, and it's a matter of infiltration from the top, saying you cannot use these unscientific, quote unquote, meanwhile there's thousands of studies, methods over drugs as a medical doctor. Here in Canada, is it bad? Yes, it is. But down in the States, there's more freedom to advertise. You can say, we see lots of doctors on social media who go over all these alternative treatments and don't hesitate about exactly what they're doing, because the regulation isn't so strong there. Here, we have to mention everything and be careful about what we say. You can't say vitamin C is an antioxidant. We can't say that. So it's, are we over-regulated? Absolutely. Well, we will look back at this time and say, oh my God, remember when we couldn't do X, Y, or Z? I certainly hope so. Mm-hmm. So as I see it evolving, and we had talked about this, is that Health Canada goes into the Health Canada for the medical side, the Health Canada for the natural side. And we have practitioners of TCM, naturopathic doctor, massage therapists. We have doctors of chiropractic, all taking care of the regulations in Canada, not Health Canada as it is now, because that's pharmaceutically driven and it moves ahead with all their agenda, which is completely different from how we function as alternative practitioners.
Natasha, do you feel that you know, we're inhibited in what we can say and perhaps how we can practice?
Yes, I was teaching for a while, like, the ethics of practice for Chinese medicine, and we were not allowed to, you know, say that we cure anything. Like, you cannot say even that you cure back pain, or I'm just going minimally. Not to mention, you know, you wouldn't be able to say you cure cancer or you cure colitis. You couldn't say that. You basically say that you are well versed in treating these diseases and these conditions, and that's basically it. Otherwise, it's classified as like a false advertising.
Yeah, which is interesting. So just so that the viewers understand, Sean, what you were saying is one of the treatments that naturopathic doctors like yourself, and not just naturopathic doctors, but I definitely, you know, I think, okay, if I need an intravenous vitamin C treatment, where's the first place I'll look is a naturopathic doctor.
Yes.
Yeah. And so there's study after study after study showing that high doses of vitamin C are extremely favorable for treating many cancers, whether you're also engaged in the mainstream medical system or not. But you can't share that, or you're going to get hammered.
Yeah, we can't pair the IV vitamin C or the oncotherm hyperthermia or the mistletoe therapy, anything that we do, or the ozone therapy that we do with a condition. You can't say IV vitamin C treats cancer. You can't say you're a cancer treatment clinic. You can't say any of those things, and you can't provide the studies. So, and this was what we were able to do a while ago, is we could say, okay, oncotherm hyperthermia helps cancer in these several different ways. There's a myriad of studies. In fact, there's studies published every 3 months, and we would post them. I'd put them on the webpage. People got to know, researching. Another woman that came in today, she says, I've been looking for you for 2 years. And she says, I haven't found you. I said, well, she said, what's up? And I said, we can't promote. We cannot advertise that we do anything for cancer at all. She says, I put in a specific term, and she gave it to me. And she said, finally, I put that in and you came up. And I said, okay, well, thank you. I'm glad that you finally got here. Now let's do some work together. So the restrictions just go to kill people. Now, like, that can happen. That is very much a worst case scenario for restricting these ability for Natasha and I to say what we do and what we've done. We can't put up testimonials. People can't. We've done, such great work with Natasha. She's, wonderful. Thank goodness for her, because my leg pain is gone. My back pain is gone. She's also helped me with X, Y, and Z because of her Chinese medicine. All these things we can't even say, and we cannot post anywhere as well. So the limitation is probably 1 or 2% of what we should be able to tell people. And that's the restriction. I mean, you can put IV vitamin C in here, you can put oncotherm hyperthermia, but you can't, on the separate page, you can say the things that we treat. We can't even say that we do treat cancer. So it's a real, I want to bump it up and say, who put these rules together? Which was the person responsible for this? And when the investigators came from Health Canada, they sat down in the clinic. I said, well, where does this come from? And none of them knew. None of them actually knew why they knew why they were there at the clinic to investigate, but they didn't say where those directives came from.
The whole thing's really interesting. It's not the purview of this conversation, but likely I'll explain it, sometime during the health show, is we've structured, so the federal government doesn't have jurisdiction over health. So we have a constitution that says the federal government has some jurisdiction, the provinces have others. And generally speaking, courts agree the provinces have jurisdiction over health because they handle hospitals and they handle property and civil rights. And, they've just traditionally interpreted that, which is why the two of you are regulated by provincial authority. Your colleges are provincial colleges, and why, even doctors that are paid for, medical doctors by the, in the healthcare system, the province pays them. The province runs the hospital. The province decides what treatments, I'll say in quotation marks, the province decides what treatments to provide in the healthcare system that's paid for by the provincial government. The provincial government pays for the hospitals and pays for the prescription drugs if they're covered and things like that. So in the federal government, when they step into the drug approval world, this is actually the exercise of the criminal law power, which is why they likely, if courts were, I'm sorry, but if courts were doing their job, likely the federal government would not have jurisdiction over natural health products. So if we're going to talk synthetic chemical drugs, you can make a pretty good argument that they present enough of a risk, because in most Western democracies, one of the top 5 leading causes of death are prescription drugs taken as prescribed, so we're not even abused. No, that's risky enough that you could exercise the criminal law power and say you can't just put a synthetic chemical on the market without our approval. We're going to regulate that. But when we're getting to something, like encapsulated parsley, the natural health products, all of them on the shelves, like, I don't know, is there 80,000 of them? There's less now than there used to be. Well, in a given year, we can't point to a single death caused by them. In a 10-year period, we're hard pressed to show a single death. And yet peanut butter causes a number of deaths each year. Shellfish cause a number of deaths each year. And none of us would agree that the federal government could criminalize peanut butter and put people in jail and give them $5 million a day fines, because yes, there's harm, but we live in a world where we're mortal beings, and there's some harm, and there's a criminal threshold line. So likely they don't have jurisdiction over these products at all. But, Sean, you raised an interesting question. Who gave them the directive when they're in your office? Who gave Health Canada the authority to be the sole decider of what treatments we can take? Because they take the position, if we haven't approved it, chemical or natural, you can't access it. How do they get that type of authority?
That's the question I want answered. I want someone to say, look, the directive came from here, and why not talk to them directly? Like, why not just say, okay, if that was the case, let's talk about it. And let's talk about the people. Why send people who have no clue? And they were all young. They were 22, 21, and about 19. There was a guy sitting in the back scribbling notes as they came in to inspect the clinic. And I thought, these poor kids, they really don't know, what they're doing. They have no clue whatsoever. But I want to talk to the person who thinks that they're getting, because this is our taxpayers' money. This is where our taxpayers' money is going, to spend thousands, tens of thousands, probably even millions to say, okay, these natural health products and these natural treatments are not allowed to advertise X, Y, and Z.
So
yeah.
Let me answer my own question. Who gave them authority? Well, at the end of the day, our Food and Drug Act is written to define drugs so broadly that it includes anything used therapeutically. And then they've allowed, Health Canada to put in this licensing requirement. But, I went back and I looked at, well, when they changed this definition of drug to make it broad, what was said in Parliament? Because they had to introduce the change, and then Parliament had to discuss it. And all of this happened, I think it's 1947, 1948. I've got the Hansards. And they're making this change. And one MP asked the Minister of Health, like, well, this is broad. Like, this would include mustard packs. And the Minister of Health said, no, it doesn't include anything like that. And that was the extent of the discussion, one question and one answer, where Parliament's told, no, it wouldn't include things like mustard packs, things like natural remedies that are low risk. But here we are, it's written so it does, but without any consideration. I don't think any of this was ever intended, but here we are. So where we can't say anything, and they're the sole arbitrator of what treatments we can take. But now I feel depressed.
I want to say it's time for change.
Yeah.
What do you guys think is? Do you think there's been, because both of you have practiced, since Alexander the Great was, conquering, the Mediterranean. Well, maybe not that long, but have you guys seen a shift in kind of patients' attitudes? This is, toward, like, because both of you have been at this for decades. And have you seen kind of a shift in, what patients think about naturopathic doctors and traditional Chinese practitioners and, the whole medical system generally?
Sean, you want to answer first?
Happy to answer first or second, Natasha. But I'll take the reins here. The biggest changes in the medical side, to me, there's just more complaints about how patients are treated in the medical system. Patients are much more fans of coming to me for expert medical advice, going over their labs, going over what their trouble is, their cancer treatments. They'll come to see me to say, should I do this chemo or should I not do this chemo? Should I do this immunotherapy or should I not? Because no one explains it to them. There's no time in the medical system to spend 5 minutes to go over a lab that says this chemo is not going to work for you and explain it to the patient. Today, my last patient came in and said, okay, all my labs, they said was normal. And I looked at it and said, did they tell you that you have a thyroiditis that's caused by your immune system that's attacking your thyroid? Because she had the antibodies in her lab. She says, no. The doctor just said, everything looks good, everything's normal. Just go home. That's fine. Everything's good. And so she had TPO antibodies, which means that she's got an autoimmune disease she had no clue about. And she just came in because she knows to trust me to look at the details and to get the medical answers that she really needs. And who wants to bypass the fact that she's got an autoimmune condition because her medical doctor said, well, everything looks good, it's all normal. Not only that, but she had problems with her iron and her iron storage. So she had total iron binding capacity was a problem. So she has overload of iron in her system as well. So there's two things. And then her inflammation markers, her CRP, was elevated as well. So there's 4 things that are out in these labs, was mentioned not at all by the medical system. So this is something that happens probably 5 or 6 times a day for me. Wow. Which is the medical side has come up short, not giving them the medical information, CT scans, MRIs, whether it's their laboratory medicine and whether it's the treatments and their genetics. All of those are missed. It's just the medical system has so much little time, like they don't have the time to go through anything, and must be a frustrating journey. Not that I feel for that, I can't. I say, I can't apologize for that system. I'm sorry, but I'm going to take care. I'm going to help you. I'm going to do everything I can to make this journey easier for you. So that was a long answer, but that's, Natasha, I apologize. That was so long.
That's good.
That's been my experiences.
Yeah. And us too, it is, I do feel for the medical doctors, because I think, and I mean, the whole medical system, I am treating nurses and nurse practitioners. It's overwhelming, the system. They don't have enough care on that side. They don't have the time, the 5 minutes, I don't believe. At least that's our experience in Southwestern Ontario. What I had a professor, and he's from Australia, a PhD. He's been doing acupuncture even longer. He's in his 70s, and he was saying it is our fault as practitioners that people don't really know much about Chinese medicine, or what we can do, the scope to support them. And he said, you've got to get out there and basically educate people. And again, we are fairly limited, as we had discussed before, as to what we can promote, right? So, but I did take him to heed, and will try to educate people in the way that we can within our scopes, and with what is allowed. But yeah, I find the same thing, Sean, in terms of that people say, could you please read the blood work? Is it okay? Is this blood work okay? And yes, they do look to you as a representative of their health and an advocate for them. So I'm happy that they can come to us for that.
So do you see that as a change?
I do. If you think about, like, even people who were in our age group, like I'm saying 50s, I recall when I was in my 20s, most of them were taking multiple medications. Now even though they get the scripts, they will seek out alternative and say, should I be taking this cholesterol medication? And they come for other advice. So I think that we're in the right direction, that there potentially there is more knowledge out there that you could find, and more side effects that you can come to learn about. Whereas before it was just take this, and all, there were no questions asked.
That is interesting, and my observation is that the medical system the mainstream medical system is in partial collapse, and I feel for the people in it, because I think they're so overwhelmed that they're doing their absolute best, but they can't give a level of care that we would expect, even as a bare minimum, and that's having an effect on people. I mean, it's having an effect on the level of care. Somebody very close to me just recently had surgery for breast cancer. And they're released from the hospital after the surgery without being told at all, even what the surgery did. And now it's a good month out, and really hasn't been given a diagnosis, and hasn't seen an oncologist. And like, this person's close to me, and we're both absolutely shocked that, like, we don't know what happened at the surgery. We don't know what the diagnosis is. We're like, it truly, I could not have expected less of the medical system in that case. And the last time I was in my local hospital, I was shocked at how filthy it was. We're talking filthy. So I was shocked. Like, it was so noticeable. It was shocking. So I've been in hospitals in third world countries, and nothing was ever that dirty as my local hospital.
Mm-hmm.
And I might be off the wall, but as medical practitioners, I can ask you, like, maybe when people are sick, they should be in a clean, sanitary environment. Like, I might be off.
But
So
the system is just so overwhelmed. My dad was on his last day, and I was with him in the hospital, and he was just out on a stretcher in the hallway, and he passed away within 6 hours after that. But I pleaded with the doctor, who was just walking back and forth, and I found finally someone who would listen. And I said, you know what, my dad, he couldn't even speak at that time. He could barely breathe. And I said, can you just please get him a room? That's all we want, is to get him in somewhere. And he had been out there. We had been out there for about 8 hours in the February in Winnipeg. So it's minus 50, outside, and he's freezing, and he doesn't know what's going on. And so finally we were able to get him a room, and then the nurse called me in the morning that he had passed away. So the system is that it was broken before COVID. COVID broke the system. It's shattered. Mm-hmm. Doctors are leaving. So I have a personal connection with one of the oncologists who is a friend of a friend. And she said, I would love to send patients to see Dr. Caesar. I really believe that he's going to help them with his medicines. But as an oncologist, my college doesn't allow me to do that. So guess what she did? She packed up and she left. She went down to the States, where she could have that freedom as an oncologist to do better things for her patients. So we're losing the good doctors, and who's left? They're not necessarily bad doctors, but the doctors who are just following the system, which is not an effective system. It does not put the patient's care first. For someone like that to have to wait 3 months for an image, no, I'm going to drive down and get it done today, right? So we really do not have a system that is built for the patient's survival and for their utmost health at all. We're built as a system to go for emergent healthcare, and that is it. There is no maintaining health prevention involved in the system right now whatsoever, and it's getting worse. It's not getting better.
Yeah, well, and hopefully, none of us are happy with this state of affairs, because I'm seeing somebody close to me, really suffer, and part of that suffering is mental, spiritual, because of the uncertainty, and really what I can frankly say is a total lack of caring. Like, I know the two of you touch your patients. Mm-hmm. You look them in the eye. You you do what you can to let them know that you're there. And in fact, Sean, it became clear that's part of your practice because you're dealing with people in crisis that kind of need that steady hand, so to speak, right? Although, everyone watching this knows you're a softie. So it's just the way it is. Sorry, busted. Yeah. So, but I think we're in a transition right now. Like I think that sometimes you need, a system has to falter for us to learn to do something better. And what I really appreciate about the two of you is it takes some bravery to come on this show, takes some bravery to participate in the health show, and I think you're doing it because you want us to have this dialogue. And it's not without risk, right? Like you guys are speaking about the system being faltering and suffering, and you're speaking about making a difference. And we're trying to do it all carefully. It's crazy that we even have to do that. But I think this is part of the journey. I have to tell you, like here we are, we're marching the charter across the land. And I remember when it was drafted in 2008, I remember I was right. I participated. I did most of the drafting, but not the idea creation. This was a collaborative effort. And I remember we have a big, ceremony. We take pictures. We've got like this nice bound book with the charter. But did I believe we would ever see the Charter of Health passed into law back then? Do I believe we can now? Yeah. We got a battle ahead, right? But I think we can, because I think the system's going to be in crisis. And I think Canadians are getting tired of being told that they can't. They want to be able to control their own health journey, and they want their practitioners to be free to, with their best efforts, right? And Canadians, I think, are getting tired of the truth being hidden from them. Like, I think it's time. So I think yeah, sorry, I didn't mean to cut you off, Natasha.
I said we're there with you. And for me, the best image is that we're can all work together. So potentially, because the system at this moment in time is overwhelmed, hopefully they will reach out. People will reach out to us. We're here to help. And until everything, because instead of waiting, potentially even the person that is close to you, if she sought out a naturopathic doctor in the interim, that would also help her, right? Because there's the guidance. Or if she came to me, for example, we could at least do some support, like mental, emotional, spiritual, give her a little bit of extra energy until she is seen. So inevitably it needs to be a full care, right?
Mm-hmm. Oh yeah, I can't imagine, like during the election, and the figures were inflated, but just how many Canadians don't have the medical doctor, and the system's so taxed. And you mean like now Health Canada is trying to shut down the natural health community and throw us all into chaos and take our products away? Like, do you really? Like, I mean, really? And yet that's what's happening. So but it can't work because people aren't gonna take it.
That's right.
I think maybe. Oh, sorry, Sean.
Yeah, no, I don't think that that's a possible future, because there are so many that trust the medical system. That's the natural system for them. It's without a doubt the number one, I would venture to say, place where people are now turning to because of their disappointments with the standard medical care. It's just built into the system now that you have to look elsewhere. You can't get your things that, and I go out on a limb to say that, but being in the chair, seeing the patients coming in, that's the story again and again. It's that the help isn't an adjunct health. The help is essential that they get from practitioners like Natasha and myself. It's ingrained. It's part of their DNA. There is no turning back, and the momentum is forward. The momentum is forward for us as practitioners. The momentum is not forward for the medical system and the drug system. It is either stalled or moving backwards and broken. And it's a frustrating system for patients. Patients are at the center of everything. And I tell them that everybody should be working to get you on board, to get you better. And they do not feel that at all from most of the medical care. There's a group of, like today was a great medical doctor who said, you know what, whatever journey, if you're going to see a naturopathic doctor, I'm supporting you, I'm helping you out. I don't hear that a lot. I wish I heard that more. But it was refreshing for me because I really want to be part of a team, as Natasha does, to say, okay, you see your medical doctor, I'm going to send the medical doctor a note or the oncologist a note and say, okay, this is what we're doing. This is how we're supporting. And these are all the studies behind it.
Yes.
You know, and that's the group that we want, our patients want. And the medical colleges, they're the limiting. So the medical college says, nope, there's none of that. There's no support of anything that is alternative or complementary. We're going to come down on you if you do go into that realm. So as much as patients want it, as much as we want it, the medical system is not set up for success. It's
part of the control grid. And so, you know, I was talking earlier how Health Canada is the sole gatekeeper on what treatments we can use. Well, we've set up our drug approval process where for serious health conditions, for the conditions that, you know, we're offered, you know, most of our treatments, the only drugs that can get through that are novel chemical drugs, so synthetic chemicals that have a patent. So like in our lifetimes, so and everyone watching this, I don't care how old or young you are, with the exception of one drug that was sponsored by government, the only drugs that have been approved for serious health conditions are drugs that had a patent. They're synthetic chemicals. And this is by design, and it's been this way for over 100 years. And then the federal government intrudes into provincial healthcare. So it's provincial jurisdiction, but we had Trudeau Sr. in the early 70s, Pierre Trudeau, say, oh, well, but the federal government has all this power to take money from everyone in taxation. So I'm going to take all this money and have this big pot of money, and then I'm going to say to the provinces, I'll give you nosebleed amounts of money for healthcare, but you have to follow the Canada Health Act, which legally then mandates you to provide a certain type of healthcare, which is giving these chemical drugs. And the provinces take this money, and now we have one type of healthcare instead of provinces trying different things. So we'll only approve chemical drugs, and then we'll only fund chemical drugs in a healthcare system with one type of practitioner, the medical doctors, which, you know, have almost near monopoly in giving access to these chemical drugs. I call that a control grid that doesn't bring good health outcomes.
Mm-hmm.
But that's, I think they're going to ride that bus as far as they can. I think they're going to try and destroy a lot of natural health practitioners and companies along the way. But Canadians, because we can't give up our health, we'll just go underground. We'll be unregulated. They're going to lose control, whether it's pretty or ugly. And we're hoping that we'll do it in a civilized, rational way and do things like enact the Charter of Health Freedom. So I think we'll let it go there. I'll let both of you just, you know, if you have any parting comments. I'm optimistic for the first time ever. Whenever there's change, usually it's because there's a need for change. And I think Canadians are much wiser about, we have to start taking responsibility for our health. And that includes protecting our access to the natural health community.
Here, I'm with you on that. And yes, tell the patients to be advocates of their own health. I tell them this every day, and keep searching for support until you find that your system is back to balance.
Yeah, and that seeing the alternative practitioners is a big part of getting better. If they want success, You've got to have a well-rounded picture. And once they see, if they haven't experienced it, they just don't know the side of medicine that is so good, that they can get so much understanding, so much help for. And it's just, and then they tell someone else, and it comes through. You get droves. We had buses of people coming in from Saskatoon, for instance. There's a busload of 8 of them, and we got each one of them better over time. Well, the one guy said, I'm just going to be the only one driving up. And I said, we'll try and get you better. So we fixed him up as well. So right now it's a word of mouth, because, you know, we can't say what we do. And I'm looking forward to the time when we look back, Natasha and I, and say, hey, remember those days back when we couldn't say that we did X, Y, and Z, and that we helped people this way, or people couldn't, you know. And I'm looking forward to those days. That's how I tend to envision the future, is that this is a bump in the road, and that we're going to hit it hard and get on the other side with a huge success, because that's the momentum. The momentum is for our success as alternative healthcare practitioners, and the movement ahead is that everybody wants us.
That's great.
Well, those are good parting words. I enjoyed this conversation. You know, you never know where it's going to go on one of these talk forums, and that's what's kind of fun. We can just go where we went. But I enjoyed the conversation, and I want to thank both of you for attending on NHPPA Talk Forum.
I truly appreciate it. Thank you.